In this video, we will look at how employers can equip workers to maintain hygiene at workplace and take preventive measures for containing the spread of COVID-19 infection at the workplace. Set up a workplace policy regarding regular and thorough hand washing with soap and water or towards maintaining hand hygiene with alcohol-based hand rub. Everyone at work needs to wash their hands regularly, before starting work, before eating, frequently during the work shift, especially after contact with co-workers or customers, after using the bathroom, after getting in contact with any form of body secretions, excretions and fluids such as sweat, mucus and others, after getting in contact with potentially contaminated objects like gloves, clothing, masks, used tissues, waste, and immediately after removing gloves and other protective equipment.
Remember, do not touch eyes, nose or mouth before washing hands. Hand washing should be done in batches to prevent overcrowding in washing areas or in the restrooms.
Remember, hand washing with soap for 25 seconds washes out 99.99% of the viruses. Let us look at the 7 steps of washing hands properly. Step 1. Wet your hands and apply soap to create a good lather. Step 2. Rub palms together. Step 3. Rub the back of your hands. Step 4. Interlink your fingers. Step 5. Cup your fingers. Step 6. Clean the thumbs. Step 7. Rub palms with your fingers. Now, wash hands with water and dry them well. Display the signage of correct hand washing techniques in washrooms, canteen, wash area and other places. Install sufficient number of hand washing stations in the premises. If feasible, use foot-operated or sensor-based soap dispensers and taps to avoid any direct contact and contamination. Install sensor-enabled or foot-operated hand sanitizer dispensing machines at work premises, especially at the entrance, meeting rooms, and other common areas. Provide enough hand sanitizers at easy-to-access location for workers. COVID-19 can spread through droplets generated when we sneeze, cough, or talk loudly. Thus, make sure that everyone wears a mask at the workplace while maintaining safe physical distancing. Disposable masks must be discarded every day after use and should not be reused. Cloth masks can be reused, but they need to be washed daily after use with soap and clean water. Remember that masks should fit your face and nose properly. The mask should cover your nose and mouth completely, and there should be no extra space between the mask and the face. Masks with 2 or more layers of washable, breathable fabric are more effective. Increase ventilation through natural aeration or artificial ventilation, preferably without recirculation of the air. Windows should be opened at least a few times during the work hours. Natural airflow can blow out the virus. It is important to keep the work premises clean, especially the areas which are touched often by people, also known as high touch points. This includes water taps, doorknobs, control panels, switches, keyboards of shared computers, etc. These points have the risk of acting as transmission points for virus through direct contact. Identify these high touch point areas. Assign cleaners and train them on how to clean and sanitize these areas. Inform them to wipe or clean these surfaces using disinfectants at regular intervals. Managers and supervisors should ensure that all necessary supplies like gloves, masks are provided to the cleaning staff at the workplace for their protection. Ensure that the cleaning staff are provided proper training to protect themselves while cleaning and disposing waste. High touch points and all surfaces and areas in the workplaces should be cleaned using a concentration of 0.1% of sodium hypochlorite or bleach or an alcohol disinfectant. Let us keep ourselves and the workplace safe by following these simple and practical measures. Remember, Frequent hand washing and wearing a mask as well as maintaining physical distance are essential as prevention measures to reduce the spread of COVID-19.